Incarcerated women are some of the most vulnerable in today's society. Pregnancies in this population are usually unplanned and can be compromised by the lack of prenatal care available to inmates. Due to the lack of resources, the care that is provided to these women is very different from the care that is provided to women living in societal norms. Out of all the women who become incarcerated, 3 to 4% of them are pregnant, and 1,400 women per year give birth while in custody. Options are limited for these women, and it is of utmost importance that we as healthcare professionals identify the values and beliefs, risks and challenges and interventions available to this population. It has been a belief in the past that incarcerated individuals needed to be restrained or shackled at all times, even a woman who is in labor. Ideologies on this practice have changed, and in 2007, policies and procedures for the use of restraints indicated that they should not be used when a pregnant woman is in any stage of her pregnancy, labor, delivery, or postpartum. The use of restraints on pregnant incarcerated women in labor is not usually necessary due to epidurals and general pain from the contractions. It can also compromise the health and care of the mother and newborn baby and is incredibly demeaning. There is no data to support this rationale because most incarcerated women are nonviolent offenders. By not using shackles on laboring women, we are able to preserve their dignity and provide them with compassionate nursing care. If restraints are needed, they should be the least restrictive possible to allow for changing of positions and comfort. Additionally, there should always be officers near the patient to remove the shackles at the request of medical staff. The most important value is that placing restraints on incarcerated women in active labor should be avoided at all costs. Being pregnant while incarcerated can be emotionally isolating, especially with the knowledge of impending separation from one's newborn. Because of restrictions on hospital visitation, these women typically go through childbirth without a support person, which exacerbates their feelings of isolation and emotional distress. The support of nurses can make a significant difference during the labor process, as nurses can provide comfort and care to alleviate some of the emotional turmoil. It is important that nurses provide the mother unbiased care during the labor process and throughout the entire pregnancy. Women who are pregnant face multiple obstacles while incarcerated. Something as simple as comprehensive prenatal care is often not provided for this population. There are 43 states that do not require medical examinations as a component of prenatal care. This is a major challenge for incarcerated women, one that only can be resolved by implementing universal guidelines that would promote equilibrium of prenatal care. Incarcerated women should undoubtedly receive access to prenatal care on a regular basis and have 24-hour access to emergency obstetric care, promoting greater survival rates of both mom and baby. Nutrition is often overlooked but a crucial part of the conversation in discussing challenges faced within this population. Adequate nutrition can contribute to an uncomplicated delivery of a full-term newborn with an appropriate weight for gestational age. However, meals that meet standards of being nutritionally balanced and frequent are not guaranteed within correctional facilities. This can affect growth, development, and overall health of the baby, as well as have negative effects on maternal health. Among the challenges involved in this population, the greatest is determining how to proceed after the baby is born. As the mother is often required to relinquish her child 24 hours after birth, she may identify a family member or other responsible party to care for her child while she remains in custody of the state. If the mother wishes not to have custody of her child, adoption is another option. When the mother does not name a responsible party to care for her newborn or chooses to proceed with adoption, the state assumes both custody of the child and responsibility for the placement. Some correctional facilities have implemented nursery programs that allow the woman to keep their baby in a special wing of the facility for a period of her sentence. Although there can be hesitancy surrounding programs like this, women who participate in the programs have lower rates of relapse and their children show no adverse effects as a result of their participation. In fact, by keeping mothers and infants together, prison nursery programs have been shown to prevent foster care placement and allow for the formation of maternal-child bonds during a critical period of infant development. Unfortunately, these programs are not readily available for most incarcerated women. To qualify, women cannot have a history of violent crimes, and both mom and baby must be completely healthy to participate. Since nutrients from the mother's milk makes a huge impact on the development of the baby and their future health, incarcerated mothers wishing to breastfeed should be allowed to either breastfeed their infants or express milk for delivery to the infant. However, this can be difficult to facilitate and is a challenge in prisons that don't have a nursery. Ideally, if the mother wishes to express her milk for her child, accommodations should be made for freezing, storing, and transporting the milk to her baby. Correctional facilities should adopt policies that support breastfeeding education and provide for the ongoing provision of breast milk to infants through the first 6 months of life. As medical personnel, we must rid ourselves of the personal biases that are associated with convicted criminals. Only then will we be able to provide the highest quality of care to both our incarcerated patients and their babies. Additionally, uncompromised care will likely result in higher infant and maternal survival rates that further justify success. We will know that we have succeeded when an incarcerated mother and her child are cared for with the highest and safest standards of care, without prejudice or bias present in the process.